Hello, everyone. Welcome to the Global Elbow Podcast. So we're very happy to start this, and there's no one better to start it with than Roger. So this is, we want to get to know you a little bit better. So you're a big name in elbow surgery. You're almost a synonym of elbow surgery around the world. I've known you, and I'm very lucky to have known you for a couple of years. And I would like to take the advantage of this opportunity for you to show everyone, younger, older elbow surgeons, who you are and how did you become Roger van Reit. That your name is Roger, not Roger.
Not Roger, no.
So to make it clear for everyone. And so how did it start? So how did a boy that comes from the Netherlands, not from Belgium, came to the Netherlands, starting as not an orthopedic surgeon. Tell us a little bit about your story.
Yeah, it's a long story, as you know. I was born in '71, so a long time ago in Holland. And my parents were very young. My mom was 18 when I was born, my dad was 21. And they took, I've got a brother, Raymond, and Ramon in French. They took very good care of us, of both of us. And I've been extremely ambitious from when I was younger. Like my mom, when she told stories of things that I don't even remember, apparently I was always very ambitious. And first I wanted to be a cyclist. And I tried that, and I probably wasn't good enough, but I also fractured my collarbone twice, and my olecranon, and my radial head. And I always used that as an excuse that I didn't become a professional cyclist. But I'm actually very happy, because then I trained to be a physio in Eindhoven in the Netherlands, and then worked for a year. And then my now ex-wife, back then my girlfriend actually at the time, she wanted to go to Antwerp to study jewelry design. And then I said, okay, let's do it. I'll go back to school and start medical school, because that was sort of, when I was still cycling, I was debating physiotherapy, medical school. And I chose physio because I thought it was closer to sports and it was closer to home. That was also one of the aspects. So then I stopped working, and then went back to medical school, and then I worked literally every vacation that we had. I worked to pay for medical school. And then the plan was always to go back to Holland for the advanced training. But somehow I got into research. That's not somehow. They told me, if you want to have a spot in orthopedics in Holland, you have to do research. So I started research, third year medical student, I think, and in Belgium back then it was 7 years. And turned out I really liked it. And we ended up doing a PhD in Mayo Clinic, and that's how my elbow interest got started. The PhD was already on elbow, but I met Dr. Moria and Dr. O'Driscoll, and then, it just went from there.
How did it happen, the PhD in Mayo? Why Mayo? Who sent you there?
My old professor. So Professor Verstreken was a professor when I was in training, or when I wanted to go in training, and basically. So again, that's another side story, but that's important for the decision. When I was working as a physio in the vacations, I worked as a locum in the UK, and the advantage was that it was quite well paid. And a locum, as you may know, you don't pay taxes, you don't pay social security and stuff like that. And every time we went to the UK, we met some Australians, because they do their walkabout, they call it. So they usually do their degree. And then before they start working and buy a house and get kids, they travel for a while. So we met quite a few Australians, and then my girlfriend at the time again and I decided, let's do that as well. Let's finish medical school and then we'll go and travel. And but then she got pregnant in my last year of medical school. She got pregnant, so we couldn't do that. We couldn't go backpacking or anything like that.
So your fault?
Well, I think it was two of us, but. It's not all the men's fault, the man. But yeah, so Raf was born, my oldest son was born. And then we sort of looked for a different way, and because I liked research, went to the professor and said, can I do some research? He said, yes, but only if you do it abroad. Don't do it in Antwerp, do it abroad. And then we ended up going to Mayo Clinic, because I met Dr. Ahn. Well, no, I was going to meet Dr. Ahn at a meeting somewhere in Germany, but then he had a problem with his back. And anyway, we ended up going to Mayo Clinic anyway. And I loved it. I loved basically every minute of it. And because of Dr. Mori and Sean O'Driscoll, who's the president of GEN, of Global Elbow Network, the first president, I loved elbow, and somehow I don't know. I mean, I don't have to explain it to you guys because you all have elbow, and it's weird. It's a weird thing, and so from then on, I started doing more elbows, and I was interested in elbows during my training, and then I found a job in the hospital that I'm still at, AZ Monaco, where you visited, or did your fellowship with us, luckily, and they said, okay, we can hire you for elbows, and I said, well, that's impossible. No one does only elbows. I have to be shoulder and hand. I did fellowships in Australia with Greg Bain, who's here as well, one of the founders, and Simon Bell, and it was shoulder elbow, and Greg does shoulder elbow hand. So that's what I wanted. I want to be upper extremity. And then they said, no, we have so many patients. You'll be an elbow surgeon very quickly, and that's what happened. First year I did everything. After 1 year I didn't do shoulders anymore, and then after maybe 6-7 years. My hand practice, I never really liked hands, so I did carpal tunnels and trigger fingers and easy hand surgery, and that ended a while ago as well, and now I'm 100% elbow surgeon, which is almost like a dream come true, I guess.
Yeah. So you're like the bad boy of elbow surgery. So were you always a bad boy?
No, not a bad boy, no.
You don't consider yourself a bad boy?
I also don't consider myself a big name in elbow surgery, like you said. When people say that, I feel funny about that, because it doesn't. You know, many people ask me, how did you become successful? How did you become this and that? And I don't see myself like that. And I also have the feeling that as soon as I see myself like that, I'm going to stop evolving. I'm going to stop wanting stuff. So every time I reach a goal, I go like, oh, what's the next one? What's the next goal?
Yeah,
that's pretty weird.
That's a personality trait, I think.
Yeah, which, sometimes I wish I wasn't like that.
Yeah.
So I could just sit on the couch and be happy.
Yeah.
That doesn't happen.
But imagine if you could talk to Roger, 19-year-old Roger, what would you say to him?
I would probably say train harder and be a cyclist, because that's sort of still a dream that never came true. That's what I'd probably say.
Don't break your
collarbone. Yeah, don't do this race and this race. I would also give him the lottery numbers. So the money is no option, no problem anymore.
But you kind of won the lottery in elbow surgery.
Yeah, so I'm very happy. I'm very happy with what I do.
I think you're because you still have a lot to do in your career, but you're having a remarkable career. And the other way around, if you think that the 19-year-old Roger could see you now, do you think that that guy will look up to you, would say that you're...
Yes, for sure. Because the 33-year-old Roger was sitting at a meeting somewhere in, I think it was in Edinburgh. I was sitting at the meeting and I was looking at the people on stage, and I thought, wow, wouldn't it be great if at some point I would be able to at least present one time? And so yes, that's something that I would never have imagined back then. It was not part of my imagination. It just happened, and every time a little bit more.
Who would you say was like the central pillar of your career in elbow surgery?
Well, Dr. Maury.
Okay.
Yeah.
So what's your relationship with him? How you?
I see him as my orthopedic father, and I think he sees me as such as well. We had a great relationship always, and I'm really sad he's not here. But he pushed me.
I think that he's here.
He's here.
Every time 2 or 3 elbow surgeons are together.
Yeah, Dr. Maury is always there.
Yeah, he's always there.
He pushed me, and there was one anecdote maybe that I can tell. It was at an American Academy meeting, and I was very young. I was nervous. I printed out my presentation. I was shaking, and the guy before me was also a Mayo research guy, and he had some questions. And every time he had a question, Dr. Maury got up and basically answered the question, because he saw the other person was struggling. And then I was doing my presentation, and then I was struggling as well. So I was like, yeah, maybe it's best if Dr. Maury answers this. And he goes, no, you do it. So he basically, pushed me under the bus. And then afterwards I asked him, why did you push me under the bus and help that guy? And he said, I didn't push you under the bus. You did great. So he gave me the confidence and the trust as well. Like he trusted me to give the answer and not to do something stupid. And,
so do you find it's important to have a mentor like that?
Yes.
This is why you keep getting people and receiving people in your department.
Yes.
Do you try to be that guy for younger surgeons?
I try to be friendly. I try to be available, but it's getting harder and harder because it's so busy and so many. I think we've had more than 200 visitors already, and so that's sometimes difficult. But for example, you and Peter and some other people I'm really proud of when you guys are presenting. I'm proud of you. I'm looking at you and I'm proud to be part of that story a little bit.
It goes both ways, I think.
Yeah, but
it's a nice
true.
relationship.
Yeah.
So what would be like your main advice for the younger surgeons that are still trying to figure out if they should invest in elbow or if they should go to a more popular field like the knee or the hip?
No, definitely choose elbow. Elbow is great, it's a great specialty. And the main thing, the nice thing about elbow is that first of all, the community is very friendly to each other. And that's because we don't know the right answer. So it's not black and white. And what that means is there's still lots to develop and to explore. So if you're a young orthopedic surgeon and you're willing to explore and put in some time, then elbow surgery is great. It's not like knee surgery where people are unfriendly, and also putting in a total knee prosthesis. I mean, it's being done by robots now, so it's not that not that difficult. You know, I think I'm not sure.
Yeah, I agree with you. I think that one of the things that fascinated me the most about the elbow is that there's so much space to grow. This is why I went to orthopedic surgery, because in comparison to other surgical specialities, there's so much place to grow, so much more that we need to understand that we can achieve. And with the velocity that this is going, we can do it in our lifetime. We can actually do a lot.
Yes.
So this in elbow, this is especially true because you know, all the science is still evolving. It's still like in a baby, and this is why global elbow and elbow meetings are so important. And this is why people like you, who somehow were directed to a career in which they do exclusively elbow, which is still nowadays very difficult. You don't find a lot of places in which an elbow surgeon can actually just do elbow, because there are not enough patients, or they can't just make a living with just elbow. So there's a lot of things that come into play. And you're an example, and visiting you and seeing how you work, it's a very good inspiration.
It's because my group allows me to. And actually, in the beginning, didn't even. They said it was possible. They gave the trust, and they allow me to. They also allow me to travel. You know, they allow me to have visitors.
Yeah.
So our group is really special in that aspect.
That comes to my next question. That is, you have, and I know that you have a very specific and nice group of friends / co-workers. So you're like a boys band.
We have some women now, since you were there.
Yeah, okay, but you know what I mean.
I know what you mean, yeah.
And you're all very successful in your own areas. So tell us a little bit about that friendship that you have with Olivier, with Peter. How does that work, and how important is it for you
Very
as
important.
an elbow surgeon?
So Olivier Verborgt is a shoulder surgeon. For those who don't know him, he's a shoulder surgeon. He's been my colleague forever and friend. He was the first to do a PhD in Antwerp, and that sort of opened the door for me as well. So my professor was supporting him, and Olivier had a great time a great successful time in the US, and that's why our professor said go to the US. Peter Verdonk, who's a knee surgeon in our group, is sort of similar to what we do. So we travel a lot. We're able to talk about our passion. And Peter actually had a different story. He was in the University of Ghent because his father was an orthopedic surgeon there. And when his father retired, we saw the opportunity to snatch him. So because obviously we knew each other before, and so we called him and said, listen, if you're interested, maybe there's a future in Orthoca. So we have some people that travel, and it's actually in our contract even. Like we get extra time for travel, we get extra time for research, we get extra time for to make sure the group goes out internationally as well. That was one of the other things that they told me. So I was hired out of the three of us. I was the first one, and they told me make sure that our group, put it on the map, because our group was always well known on high volume and about lots of surgery and all that stuff, and they. But it had a sort of a bad name of being a factory. Like people come in, get surgery, and boom, out, with no research, no output. And now we publish way more than the universities in Belgium. We present way more than the universities in Belgium. So now our group is seen partly academic and next to the clinic.
And for people that want to gather a team around them, like you. So what's your advice for ego management? Because orthopedic surgeons are very ego driven. So you always want to be like the biggest guy or the biggest girl in the room. So what's, in a few words, like what's your advice to manage
Funnily
that?
enough, that doesn't happen that much in our group.
Okay.
Because when someone achieves something, the rest is very proud. And so there's no jealousy. There's no jealousy like, oh, I want to do this or I want to do that. We just, congratulations, and genuinely we're proud of each other because we know the bigger the group gets, the better it is for us. And so funnily enough, that doesn't happen. If there are problems in the group, because every good marriage has problems, then we try to do that during staff meetings, not behind each other's back. We just, during staff meetings we can become a little bit agitated, and then afterwards, afterwards we have a beer together and it's done. It's professional, right? So we try to avoid petty things, and we try to avoid being emotional about it. It's professional, and that's what's important in being successful. And what I think the people that worked in our group before me have done very, very well is to choose people. So we've never had an open vacancy.
Okay.
We never advertised for someone to join us. We just asked them if they're really good. We asked them.
And how do you decide? Do you like to gather and choose someone?
Yeah, it's getting more difficult because there's almost 25 of us now. So it's getting, when we were smaller, it was much easier to decide. So now the subspecialty decides on who they want. Like if there's a knee surgeon, we don't really, we can say no if we really think that's not a good idea. But in general, the knee surgeons will decide who's going to join them.
Okay. And what would you say that up to now was the hardest part of your career?
Well, my personal story. So when I got cancer, that was obviously the hardest part, and I remember my last surgery before I had to go in my last surgery before I had to go in for the surgery. I remember thinking, oh shit, what if this is my last ever surgery? Yeah. That was very difficult. That was very emotional and difficult. So luckily I'm still here, but that was difficult. And I made a promise to myself. Basically, I said, so my surgery was on the 23rd of December. I made my second surgery. So I had for those of you who don't know, I had an appendicitis, acute with a rupture. I walked around with it for 6 weeks because I thought everything was okay, or I thought it would go away.
I remember we had lunch.
That was in Madrid.
In Madrid.
Yeah. So in Madrid, I had 40-degree fever, and. And then on Tuesday, on Monday, I was in a different hospital, or a different part of the hospital. So I thought, oh, I can live with another day. And then on Tuesday, ended up having appendectomy. And then it turned out there was a tumor in the appendix. So then I had to basically went to University of Leuven, which is one of our big universities in Belgium, and I needed surgery again, together with first surgery, hemicolectomy. And then the day after I got surgery with HIPEC, which is like chemotherapy in your abdomen because I had some metastases. And so when all that happened, that was on the 23rd of December, the last surgery. And then I said, I need to go back to work the 1st of February, like 4 or 5 weeks later. And everyone said I was stupid, everyone said it's not gonna work. And even Maxime, my wife, she had her doubts because when I was at home, I was very passive. I couldn't get myself to walk around. I would go outside and walk 100 meters, and also my hemoglobin was only 7, so I was out of breath very quickly.
You looked gray, I remember.
But anyway, the last week, like my last blood test, I said, let's do it in the hospital, let's do it in my hospital. So we went to the OR, and then Maxime told me, oh, that was the first time I saw a little bit of life in your eyes again. She said, now I'm convinced you have to go back to work. Yeah. And then I went back to work full time, but half volume.
Okay.
Because I was afraid if I go half time and full volume, you know how it goes, right? You plan till 12 and it's going to be 3. And so I said, no, I'm going full time, but half volume, and that worked for me.
And your team, was it important on that?
Yeah, I think the
guys
whole
that
thing.
work with you and...
Yeah, Alex, my nurse, he's with me everywhere. He's with me in clinic, he's with me in the OR. So he took a lot of things that I couldn't do at that point. I tried sitting down a little bit more, like normal. He always switches the wounds. So he took a lot of the burden, I think, and made it possible for me to go back. So that was very important. And my staff members, the colleagues in the staff, they were very supportive. They didn't push me to come back. They actually, some of them said, "Don't come back yet." And but when they saw me, they said, okay, this is okay. I'm working on my that's my part of my rehab.
Yeah.
I needed that.
So is this Roger today the same guy as the pre-cancer Roger?
Oh, definitely not. No, definitely not. I'm enjoying myself more, like things like this. You know, we started the Global Elbow Network. I don't even know exactly when. 3-4 years ago. So that's sort of after I had cancer. And Sean and Adam Watts and me got together in Rome. And the idea of the Global Elbow Network that had already been 5 or 6 years before that. We already talked about that, but the timing wasn't right because it was a bit scary to start something new, and we were scared of, for example, CSEC. I'm the president of CSEC. Yeah. What are they going to say? What are other people going to say about it? Because will they feel threatened or anything? So I think we've been very good at not being threatening and showing that we're an addition to the orthopedic community. And I think I was more decisive. After my cancer, I was more like, yeah, let's do this. Let's just do this, because it was in my mind for a long time. Let's just go ahead, and who cares what other people say? They're not gonna. My career's not gonna get harmed by it. And now, being here it's really nice. So I think my career actually, it helped my career.
Okay.
It definitely helped me as a person, because I loved it. I love it. And this logo. So Maxime made this years ago for the first Global Elbow.
Maxime, your wife.
Maxime, my wife, for the first Global Elbow Network. And so that got incorporated into a logo that an agency made, I think.
Yeah.
And that's really nice that she was able to do this.
It's very nice. Maxime is a very nice designer. She actually designed
our elbow brace
your
as
splint,
well.
your elbow brace.
Splint, yeah. Splint's a better word.
So she's a big part of your life now.
Yeah, definitely.
So how important do you think that is to have a nice partner when you're like a busy surgeon?
Well, first of all, the partner has to be okay with you. Surgery okay, but leaving and going. This year I think I was counting it on the plane. That was my 40th plane ride of this year. So someone has to support you, and we have a son called Julian. I have 2 other boys, 2 bigger boys, Ralph and Flint, from my previous marriage. And now Julian just turned 6 last year, so he has to go to school. But before this,
6 already.
6, yes.
Oh my God.
We took him everywhere. So most of the people here will have seen Julian at some point, but now he can't, because he has to go to school, which is a shame. So now I feel this as well. Every time I travel alone, I don't like it as much.
Yeah.
And Maxime's on her way. She's on the plane from New York to Miami. She'll be here tonight.
Yeah, I feel like she's very supportive of you.
Definitely, yeah, very supportive.
So you're a lucky guy.
Yes.
Okay.
I'm very lucky, very happy as well.
Yeah, good. Is there anything else that you like to talk about?
Oh. And I remember when I was doing research at Mayo, one of the first courses that I saw, Mayo Elbow course, was arthroscopy, and I was mopping the floors, and I was hanging new water and changing the cadavers or changing the arms. And Buddy was was the invited guest. And I remember I heard him say, "I'm going to do a radial head resection, arthroscopic radial head resection," and something obviously I'd never seen before. And I think by the time I turned around, like 30 seconds later, he was already done. And I thought, wow, that's amazing. Dr. Mori is my hero, right? And I love him. And I had a patient. So what I do now with international patients, we Zoom.
Okay. Yeah, I know.
So I have like a 30-minute Zoom talk. Oh yeah, send you a patient
I
as
know,
well.
yeah.
And a 30-minute Zoom talk, and this woman, this lady lived in Houston, in Texas, and she had a tennis elbow, simple tennis elbow. She had it for 3 years or 4 years, and she seemed to be like a candidate for surgery.
And she Zoomed you from Texas?
From Texas.
Incredible.
So I said, the best elbow surgeon in the world, Dr. Mori, is in Texas, in Houston. And she's like, yeah, you sure? I said, yeah, don't fly to Belgium for a tennis elbow, right? That's just ridiculous. And anyway, so she looks him up in Texas, and she walked in the door, and the first thing she said was, I was sent to you by Professor Van Reit. He's the best elbow surgeon in the world, and he said you were good. But I'm not sure. But I'm not sure, she said, are you as good as Professor Van Reit? And I'm not sure if this story is completely right, because Bernie told me later on, so it's from his mouth. And like I said, so Bernie said, I've never had this before. No one has said, this has never happened before. I've had referrals before, but this is the first time the patient actually questioned me instead of the guy that referred. And he said, I'm so proud. He said, that's one of the proudest moments in my life. And I thought, that's him, right? That's him. He's so supportive, and I'm sure he's genuinely proud that happened. And then she had surgery. Oh, she had the 10x procedure that he developed.
And she was okay.
She was, of course. Dr. Morris the best, so he was great.
Thank you.
Right.